exam for today. The patient should be arriving sometime soon. Good. An hour long as well for the exam. I'll double check with them. Let's have the nurse send them in. Okay. Oh. Hello there. Are you here for the cranial nerve exam? Good. And to double check, have you been seen by a nurse already? Good, you've been with a nurse prior. That's good. Please make yourself comfortable, and if you could, I'm going to get a little bit close here. Could you please take a seat right at the chair that's in front of me? Yes, and you can also relax as well. No need to be stressed. This is a very relaxing exam. And welcome to Dream City Clinic. I am Dr. Cece. I will be performing your cranial nerve exam today. Is that okay with you? Okay. Are you okay with me being your primary care provider today? Good. How are you feeling, by the way? You just look a little bit tired. That's okay. Please rest your eyes. No need to be stressed during this medical exam, okay? Pinky promise. Pinky promise. Good. And a couple of questions before we begin, okay? How have you been feeling these past 2 weeks? Okay. It's okay to be honest as well. All answers are only recorded between me and this computer, that's it. And could I double check with your first and last name with spelling? It's a beautiful name. And your birthday? Beautiful. Does that make you a Sagittarius? Maybe a Capricorn? Okay. So, have you been sick within the past 2 weeks, or how are you feeling? Maybe any sense of vertigo, fatigue, etc.? Okay. And how's your sleep been? Okay. So, on my report here, it says that you have fallen asleep and you may have bumped your head somewhere, causing your sleep to not be as good. So, we always double check with a nurse exam, then a cranial nerve exam when that happens. And trust me, it happens all the time. I actually was watching Netflix and I fell asleep and I rolled off of my bed and got myself my own cranial nerve exam. So, very common and normal, okay? And shall we begin? Good. So, my hands are clean. I'm just going to first touch your face if that's okay with you. Good. I'm going to get a bit up close. What the cranial nerve exam does, by the way, is we're going to be checking all 12 of your cranial nerve sensations around your face. The first test I do is for your sensory nerve, which is just sensation around the face. Okay? And I'm just going to put my hands on your face. You let me know if you feel it by saying yes or no when I ask, okay? Good. So, yes or no? Good. Yes or no? Good. Yes or no? Good. Yes or no? Good. Yes or no right there? Is that spot a little bit uncomfortable? Is that where you may have bumped your head or just fallen asleep strange? Yeah, I can see. But can you feel that? Okay, any pain? testing these several sets of cranial nerves for your eyes to make sure everything is going well. Okay, good. So, I'm just going to carefully ask you a couple of questions. I'm going to get up very close to your eyes. I'm going to put some pressure on them. Close your eyes for me, okay? Good. Close your eyes, and do you feel that? Good. Keep your eyes closed. I'm going to put pressure underneath. Do you feel that? Good. Do you feel that on specifically the one eye? Which, left or right? Good. Left or right? Good. Okay, left or right? Good. Left or right? Good. I'm going to get very much so up close now. I'm going to ask you, can you open your eyes for me? We're going to do something called a blink assessment. I'm going to ask you to blink for me. This may make you very tired. It happens to a lot of people, okay? It's totally normal that you get very sleepy during this part. But I'm going to ask you to blink at random intervals. I just want you to blink when I say blink, okay? I'll even give you a dialogue with my hands of when to open and close your eyes. Good. Okay. So, look at me, please. Good. Blink. Good. Blink. Good. Blink. Good. Blink. Great. And blink. 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 Good. Blink. 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 Good. Blink. 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 Good. And blink. Good job. Now, did you feel any sense of vertigo when I asked you to blink? And a quick update, vertigo is a feeling of imbalance. Specifically, you'll feel it in your head. If you've ever felt vertigo, sometimes you can actually get it from sleeping strange. Yes, so it kind of feels like your equilibrium is off. Any senses of feeling like you're a bit unbalanced at all, yes or no? Okay, that's okay if you do. If you'd like to, we can have you lay down as well. All you have to do is just lay down. I'll continue the exam, okay? Good. Are you feeling okay so far? You're doing good. Good job. Okay, we are going to move on now to the eye light exam. Do you have any sensitivity to light? Because if you could close your eyes and still participate. Okay, just keep your eyes open then, or close them if it feels like the light is too much. All I'm going to ask you to do simply is let me know when you see the light. Just say yes or no. Okay, I'm going to just carefully put my hand next to your eye as well, okay? So, just say yes or no when. When. Good. 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 Do you see it? Good. No. Good. No. Good. No. Good. What about now? Good. And now? Good. So, question time once more. I'll ask you a lot of these. Do you feel like the light was too much, too bright, just fine? And do you feel like you're seeing several sets of light or double vision at all currently because of that? And then can I continue using the light? Good. Okay, once more. I'm going to get a little bit more up close now. I'm going to be taking a look deep inside of your eyes, okay? Good. So, I'm just going to get a bit up close. Might just be talking to relax. Now, I'll even move your chair just a bit in front of me, okay? What I want you to do is just relax. I'm going to get a little bit up close. I am looking for something called nystagmus or nystagmus. What that is a shifting of your pupils back and forth as a way to balance your equilibrium. Sometimes if you sleep strange or you don't sleep well enough and you do experience some sort of vertigo or perhaps some sort of pressure on the head, aka that could mean anything. Nystagmus is something that your eyes do when they shift to fix with your equilibrium, and or if you have pressure somewhere along the head and the neck. Okay, what I want you to do is just look right at my eyes, and I'm going to shine the light in random intervals. Just keep looking at my eyes, okay? Again, I'll be talking to myself, just looking for things, so just look at my eyes. Good. A little bit, just going to take a line like that. So, experiencing what appears to be self-centered fatigue. So I'm just going to take a quick look, okay? A little bit of pump. We're just going to take a quick look. Just going to see up there when I'm going to look at the eyes, okay? A little bit of fatigue-centered focus. So I'm going to just see like that. I'm going to pull it like that, okay? Just going to so just a little bit. I'm going to pass a little bit like that, okay? Okay, very good. I'm going to move your chair back a little bit now. It's okay with you. Are you still feeling cozy and comfortable? Good. I did not see any nystagmus. Amazing. So, we're going to be testing your eyes with reading and numbers now, and a bit of color. Okay. You're going to see this chart behind me. And this is called the Snellen's chart. I'm going to be pointing at some numbers and some letters, and I just want you to read them with the best of your ability. I'm also going to cover your eyes at some points and ask you about the same letter to see if you can see it, or if there's difficulty with one and not the other. Let's begin. So, these are my eye chart tools. I will point with this, and I'll cover one of your eyes with this. Let's first begin. What letter is that right there at the very top of the chart? Yes, that is E. Good job. Okay, we're going to go down to line 2. Can you see anything on line 2 right there? Okay. What letter is this one right there? What letter is that? Good, that is F. Good. What letter is this one next to it? That is the letter P. Very good. I'm going to cover one of your eyes now, okay? Just covering one of your eyes up. And quick, asking you here, what letter is the top one there? That is E. Good. Covering that up again. What letter is that right there? F. Very good. And can you still see this letter right there? That is P. Good. I'm gonna cover up another side of your eye now, okay? So, can you still see the chart now? Yes or no? No. Good. Moving down. Are you still able to see the third line? Yes or no? Good. What letter is that right there? That is the letter O. Good. Going back up, what letter is the top one? E. Good. Going back down to the third line. What's this final letter right there? What letter is that? That is Z or Z. Very good. I'm going to cover your eye once more, okay? Now let me know. Any difference with the vision? What letter is that? Okay, that's still C. Good. What letter is this over there? That's still T. Very good. And covering most of your eye now. Can you still see the top letter, yes or no? Okay, barely. Okay, good. Let's use the numbers on the sides now. What letter is this top one right there? That is 1. Good. What letter is this one right there? 2. And this right there? 3. Do you notice that the letters are changing in size as the numbers are? Or do you think the numbers are staying the same while the letters are getting smaller in size as the numbers go down? Good. So, if we can see here, the numbers stay the same, but the letters decrease in size. Very good. I'm going to move on to more difficult ones now, down below. Are you able to read below the red line at all? Okay. I'm going to ask you on line 9, right there, line 9. Can you read this letter right there? What letter is that right there? Maybe a bit difficult. It is most difficult for most people. Okay. Are you seeing any doubling of letters next to each other at all? Or are you seeing any sense of difference in your vision the smaller the letters go? Okay. And what letter is that? Good, that is a T. Yes, it's very difficult. Okay. At the very end there, what letter is that? Again, very difficult to see, but what letter is that if you try your best? That is the letter L. Yes, I see your eyes are getting very tired. I'm going to cover your eyes once more with the tool. Can you still see this letter at the very last? Good. Any differences with your vision or distortions? Okay. And what about what letter that is right there? Can you see that at all? What letter is that? That is right there. That is O. It could easily be described as a D as well. What letter is that next to it? Good. That looks a little bit like O and D again. Very good. This one's actually a D. Do you remember what letter that is? Is there any distortions when I show you the first one of letter 9? Okay, that is the letter T. Still very good. And quick question. Again, once more, any distortion with your vision when I cover your eye at all? Okay. And I do see that you have very fatigued eyes. Are your eyes getting very tired? Okay. Good. So, I am going to do a memory test with you now. And we're going to ask you just to simply perform a quick eye exam. I am going to close your eyes, but I'm going to ask you just to remember the top letter here, E, for me, okay? But I'm going to ask you carefully to just close your eyes for 10 seconds, okay? And close your eyes. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Okay? And quick questionnaire. Do your eyes feel a bit more tired now that I asked you to close them for 10 seconds? Okay. And quick set of questions. Do you know what color my chair is behind me? Pink. Okay. What color are my glasses? Like a pink red. And what color is my glove? A blue. Good. What did I tell you to remember? Okay, it was a letter. What letter was the letter I told you to remember from the chart that was there? It was the letter E. Very good. Good job. So sometimes the reason that we test cranial nerves is for some sort of concussion or some sort of pressure applied to your head or some sort of vertigo. It is very often that a symptom of having some sort of concussion frequently is having the inability to remember something in a very short period of time. as a professional, I always make sure that I hit every single cranial nerve to make sure that you're okay. Okay? Good. Okay. Next eye exam here. We're going to be working on the vestibular cranial nerves, which happens to be next to your ears and is also connected to your eyes, okay? What I'm going to be testing first is sense of sound with the reaction to your eyes. So I'm going to be using my pen light once more, and I'm going to click the pen light and flash the pen light onto your eyes. You let me know how many times you see the light and you hear the click. Are you ready? First, I want you to count how many times you hear me click the pen. Let's begin. I'm going to shine this on your eyes, okay? Not too bright, though. Let's start. Count how many times I click the pen. Let's begin. And how many times was that? Okay, that was... I clicked the pen 20 times. Very good. Okay, once more. This time, I want you to count how many times you see the light flash in front of your face. It won't be too bright, trust me. Let's begin. And how many times did you see the light flash? Okay, it was between the number 5 and between the number 7. Good, it was the number 6. Very good. How many times do you think it takes for me to click the pen for the light to flash 6 times? Very difficult question indeed. The answer is 6 times 2. Do you know what 6 times 2 is? Very good. So that means the pen clicked how many times? Good. 12. Good job. Okay. Basic mathematics test. I'm going to lift my fingers up, and you let me know how many numbers you see. We'll begin the addition part with raising 2 hands up after the first test. Let's begin. How many fingers am I holding up? 1. Good. How many fingers am I holding up? 2. Good. How many fingers? 3. How many fingers? 2. How many now? 5. How many now? 2. Good. Are you ready for the addition? Good. How many fingers am I holding up? What is 2 plus 2? 4. Good. A little closer now. What is 3 plus 3? 6. Good. What is 4 plus 1? 5. Good. 1 plus 1. Good. 2. 3 plus 2. 5. 2 plus 3. 5. And last but not least, what is 5 plus 5? is I'm going to move my hands out of your visual field. You let me know the exact moment that you can no longer see my hands. The difference is I want you to only look at my face. You can look at my nose or my eyes. But we're going to test your peripheral vision around your eyes, okay? So, let me know when you can no longer see my hands in your peripheral vision, okay? So when the blue gloves disappear. Let's start. Let me know when. Good. Let me know when. Good. Let me know when. And let me know when. And let me know when. Okay. Now let me know when once more. Good. Now, reverse. Let me know when you see my hands come into your visual field. So when you see them, let's begin. Good. 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 And now, let me know which hand is closer, left or right. Let's begin. Okay. Left or right. Good. 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 And left or right. Good. Good job. You did amazing. So, your peripheral and distance vision tests are perfect. And it also looks like we have a lot of statistics about your information for your eyes. Now, a quick question. Are your eyes getting a bit dry? Let me quickly add an eye drop into your eye, okay? So. I'm going to carefully add this eye drop into your eye. This is going to relax your eyes a lot. It also smells quite good. If you smell that, it smells very similar to if you've ever had like a lavender tea. It smells exactly like that, but it's really good for your eyes. Look up for me, please. Do one drop there. And the other drop there. Good. And then blink, 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 blink. Good. Now, I am going to test your sense of smell. We'll go back to your eyes once we test your vertigo, okay? So, we're going to be testing your nose and your olfactory sensory nerves, which is your sense of smell and your sense of taste. Have you had any difficulty since you've been having difficulty sleeping with your sense of taste and your sense of smell at all? Okay. Have you been enjoying food as you used to? You deserve to enjoy good food. Okay, so I have an array of essential oils here. I will ask that for this part of the exam you please close your eyes, because it will be very easy to tell what the essential oil is because it will be in front of your face. So please promise me you will not take a look with your eyes open, okay? Good. So please close your eyes for this part of the exam. It will also let the medicine sit in your eyes. I know your eyes have been tired. So close your eyes, please. Thank you. Good. We're gonna start off with this essential oil right there. This one is one of my favorites, okay? So, go. Smell that. And what essential oil do you think that is under your nose? Very aromatic. Smells like a fruit. Very good. Smells like citrus. Good. That is orange. Fantastic. Good job. Good. And there are also no right or wrong answers, by the way. Good. This next one I think is easier, but I just need a general idea of what you think this could be, okay? So, we have this one right there. It is right under your nose. Now, please breathe that in. And what are you sensing from that? Good, that's floral. That's perfect. That already answers my question. Any guess as to what type of floral? Okay, good. This one is actually jasmine. I think this one is one of the most soothing scents. The only answer we needed from this was floral and sweet. Good job. On to the next one now. Fan favorite for this essential oil. Again, don't take a look. Otherwise it will be obvious. I'm gonna put this right under your nose, okay? And do you know what essential oil that is? You got that one very fast. This one is a peppermint, a mint, and it also reminds you of candy. Yes, this one is eucalyptus, and everybody uses eucalyptus very frequently for candy. It's amazing also for spa treatments, and I really recommend this. You can probably get eucalyptus in a spray that you can apply before bedtime. I find that eucalyptus helps you relax and sleep, and it also opens up your nose. You got this right away. Good job. Okay. Are you ready for the next one, or do you need a bit of a scent break? You're good to go. Okay. Keep your eyes closed, please. This one is fantastic. Okay. I'm putting this one underneath your nose now. Any idea what this one could be? Good. Floral. That's great. What else? Any guess? Okay, a bit like an herbal tea. That's perfect. Any guesses? Very good. If you got lavender from that, or thought about it, that is correct. Again, the answer we were looking for was floral, sweet, and also medicinal, because it does have the lavender unique smell that is very often used in spa treatments, and is also very often used for relaxation and sleep. Good. We are going to move on to the two most difficult essential oils now. Again, there is no correct answer. Just take a guess at what you think. If your guess is as good as "I'm not sure," that is also allowed. We just want you to take a guess. You ready? Let's go. So, keep your eyes closed. This one is one of my favorite. Okay. We have this one right here. What do you think that one could be? As I said, this one is pretty difficult. This one smells like a fireplace. That's perfect. So what do you think that could be? Perfect, like a tree. Good. This one is sandalwood. You did amazing. It smells like a fireplace by the beach. Amazing. I love this one for sleep as well. And the last one. It may be easy for you to identify, but for a lot of people, this is the most difficult. Are you ready? Let's go. Keep your eyes closed. But what do you think this one smells like? Okay. You got right away that it is like a tea. Very good. It is often used in teas. Okay. Any idea? Okay. A little bit difficult. You can open your eyes now. Good. This last one is chamomile or chamomile. This one is the most difficult for people to get. Either they get it right away or you can't even take a guess. You did amazing by guessing tea. Good job. Now, do you feel okay after smelling all of those essential oils? Do you have a headache at all? Or do you feel some sort of fatigue coming on? Let me know if that happens, okay? And we'll switch the exam. I'm writing your results down now. And next up on our list, we're going to be testing your sense of taste. And again, has your sense of taste been good recently? Okay. So, I'll show you what we have to work with, okay? So, I have these two liquids here. And each of these vials contains a different tasting solution. I'm gonna let you know now. One of these tastes like nothing at all. It's just water. And the other one tastes exactly like strawberries. You let me know which one is which. Again, you can't tell from the vials, but let's take a guess. Are you ready to begin? Good. Which one do you want to start with? The brown one or the green one? Okay, we're going to start with the green one. I'm going to ask that you say ah. Okay. Say ah. 3, 2, 1. Good. And then just let the flavor. Yes. That one was water. Very good. This one always gets people because it's in a green vial. Now, this one could also be water or it could be strawberry. Are you ready? Let's begin. Okay, say ah. Okay. And then just let the flavor, yes. And this one was strawberry, very good. That one actually tastes like, in my opinion, strawberry Starburst, those candies. Do you taste that too? Good. Okay. Now we're going to be testing your sense of hearing, and also this relates to your sense of vertigo. Would you like me to do the vertigo test first, or would you like me to do the hearing test first? Okay, we'll do the hearing test first. I'm going to get very up close for this. Okay, so how we do the hearing test is I have these hearing tools that make a sound. You let me know if you can hear it. That's it. I'll show you. These are called tuning forks. Now, you can't eat with them, but they have a very strange and or interesting sound. You typically use them to tune an instrument. Now, what I do is I tap the instrument on my hand, and it's going to make a sound. All you need to do is let me know if you can hear it. Are you ready? Let's start. Once more. Could you hear that? Okay. Next one. Are you ready? Let me know if you can hear it. Okay. Could you hear that? Yes or no? Once more. Yes or no? Okay. Okay. Yes or no? Okay. And could you hear the third one? Yes or no? I'll do this one once more. Yes or no? Good. Only two more now. Let me know if you can hear it. Are you ready? Let's begin. Yes or no? Once more. Okay. And one more now. Again, if you can't hear anything at all, that's absolutely okay. Let's begin. Could you hear that? Once more. Okay. Thank you very much. So the last two are typically the most difficult to hear. Did you find difficulty with this too? That's okay. Okay. Now is the sound test. I am going to whisper a word into your ear, and I want you to repeat the word back to me if that's okay with you. Good. I'm going to get on one side. I'm going to whisper a word. You repeat it back to me, okay? Pomegranate. 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 And what word was that? Pomegranate. Very good. Good. Other side. Flip, flop. Flip, flop. Flip, flop. What was that? Flip, flop. Very good. Once more now. Bellow. 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 And what word was that? Bellow. Very good. And once more. Sleep. 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 And that was sleep. Very good. Okay. Now we have to do your left or right test. Okay. What that is you let me know if the sound is coming from your left side or your right side. I will not correct you at all for this, just based off of what you can hear left or right side. I will be moving my hands away from your visual field. You can keep your eyes open though, but you let me know if I'm making a sound from the left or the right side. Do you have any hearing partialness? Perhaps one ear hears better, or you have one ear that is deaf. Okay, I do too actually, so that's okay. sound like a maraca. You let me know if you're at left or right. Let's begin. Good. 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 And left to right. Very good. Good job. Okay. Now I'm going to do the vertigo assessment. You let me know at any point if it bothers you, but we're going to be testing your eyes and we're going to be moving your head. Are you ready? Let's begin. So I'm just going to move your head a little bit, okay? Just going to carefully just move your head a bit. I know it might be a little silly, but keep your head this direction, okay? Now let me know, when do you see my pen light across the screen of your eyes? Do you see the pen light at all? Good. And when is it the brightest? Is it brightest here or here? Good. Is it brightest here or here? Is it brightest here or here? Good. And is it brightest here or here? Good. Can you see my hand moving? Can you see my hand moving? And do you see one finger or two? Good. One finger or two. Good. I'm going to tilt your head back and then the other direction, okay? And keep it this way, okay? Good job. Now, let me know, do you see the pen light now? Good. And what about now? What about now? And what about now? Let me know, when is the pen light brightest? Is it brightest there or there? Good. One or two? Good. One or two? Good. One or two? Good. And then one or two? Okay, the same. How many fingers am I holding up? Two. Good. How about now? Good. How about now? Good. And how about now? Two. Good. I'm going to turn your head back to normal, but I'm actually going to turn it a little direction this way. Okay. So, do you still see me? Good. Do you see my hand here? Good. Do you see me? Good. Let's turn it the other direction. Okay. Do you still see me? Good. Do you see my wall? Good. Do you see me? Good. Do you see my glove right there? Good. And do you see me? Good. And back to center. I'm going to tilt your head a little lower now. Okay. Can you see right there? Can you see above? Can you see in the center? What about below again? And above? And the center? Good. Do you feel any sense of double vision currently as I moved your head left to right, side to side, and up to down? Okay, and let's move your head all the way back up now. How do you feel? Good. Okay. And then lowering your head once more. How do you feel? Good. Okay. Now I'm going to remove this one glove. We are going to be performing our final exams. This is called the sensory part of the exam, but this time it will be physical. I am going to first do a hot and cold part of the test. What that is this part of the metal is very cold. Okay, my hand is very warm. I'm gonna ask you just to close your eyes, okay? Close your eyes like this. And you let me know if I'm placing the cool metal on your face or my warm hand. I'll do it all around the sides of your face and a little bit on your neck. Is that okay? Let's begin. Okay, so warm or cool? Cool, good. And warm or cool? Warm. Warm or cool? Warm. Warm or cool? Cool. And warm or cool? Very good. Warm. Okay, so we're gonna write that off as the final. You've got a very good sense of that. Now, I'm gonna ask you to just do some silly things for me. We're gonna do a sharp or soft test now. So, I have this little tool here. It has a soft part and a sharp part. You let me know what's touching you, the soft part or the sharp part. I'll show you soft first. This is soft. And this is sharp. Are you ready? Let's begin. Keep your eyes closed for this too. Soft or sharp? Good. Soft. Soft or sharp? Soft. Soft or sharp? Sharp. Soft or sharp? Sharp. Soft or sharp? Sharp. Soft or sharp? Soft. Soft or sharp? Soft. And then soft or sharp? Sharp. Soft or sharp? Soft. And soft or sharp? Sharp. Very good. Okay, I'm going to put my hands here next to your lymph nodes. I'm going to ask you just to swallow for me if possible. Good. 3, 2, 1, and swallow. Good. Any difficulties doing that? Okay. I'm going to put my hands next to your ears. Any pain? Good. Okay, and then a quick test of your reflexes here. I'm just going to put my fingers before I tap, but you let me know if you feel it. And I'm also going to be looking for a flinch. Are you ready? Good. Feeling good. Good. Good below the nose. Good on the jaw. Good on the shoulder. Over there. Give me your arm. Good, other arm. Good, and back on the forehead. Good, and then once more below the nose. Okay. So, it looks like your cranial nerve exam is complete. Thank you so much for coming here today for the exam. I'm going to be finishing off by writing some notes, but I want you to sit and relax, and then I'll excuse you in a couple of minutes once I'm done taking notes, okay? Thank you so much for performing and being in the exam today. I will give you your results right when you're done, but you're spending over the night here at the clinic, correct? Good. I'll have a nurse get you in about 5 minutes, but you can relax and close your eyes. I'll dim the lights a little bit, but I'm just going to be taking some notes, okay? Okay. Your results are fabulous.